Well, when it comes to ADHD myths, Dr. Ronald Kent of Hattiesburg's Clinic Connections sets the record straight.
He says ADHD is a real disorder that people should be aware of without feeling guilty. Fox 23's Alyssa Cole wraps up tonight's special report with treatment options for ADHD.
According to medical professionals, there are tons of misleading information about people diagnosed with ADHD who are written off as lazy or undisciplined.
You have to be bad. You have to be a behavior problem to have ADHD. Now, unfortunately, you do see behavior problems more in children with ADHD. But like we talked about before, you definitely can have ADHD and be an angel in class. You can have no behavior problems at all. In fact, you can sit back there and be one of the sweetest, calmest children in class, but just not paying attention at all. If you had ADHD as a child, you won't have it as an adult, and that's just not true. The last time I checked, there were over 2 million adults that took medication for ADHD, and it can really significantly affect your ability to perform your task at work. In fact, it's not unusual for adults with untreated ADHD to have multiple jobs and be very frustrated in the workplace because they want to do well. They want to provide for their family. They want to do a good job for their employer, but they're just not able to stay on task and complete what they're asked to do.
Harvard University's Dr. Joseph Biederman did a study on children diagnosed with ADHD along with drug and alcohol abuse.
If you're an adolescent with ADHD, but you're treated for your ADHD, then you have about a 25% chance of drug and alcohol abuse. But if you have ADHD that's untreated and you go through your adolescence, you have about a 75% chance of drug and alcohol abuse.
When a child visits a professional to confirm symptoms of ADHD, doctors like Ronald Kent of Hattiesburg Clinic Connections take careful steps to make a diagnosis.
First, they come in for a regular history and physical that we do to make sure there's not other problems that could be causing issues. Let's say the child has a lot of bad allergies. Well, that child may not pay attention as well. Let's say they don't sleep well at night. That child may not pay attention as well. And if a child is sleep deprived, which by the way is the #1 reason for school problems in America today, sleep deprivation, then they may be irritable at school and have behavior problems. So there are other things that can cause school problems.
He says his patients receive a screen reading by a speech pathologist, a full psychological evaluation by a clinical psychologist, and some general computer evaluations.
What most people can kind of identify with, the amphetamine group is the Adderall kind of medicine, and the methylphenidate group is the Ritalin type of medicine. And fortunately, about 90 to 95% of the time, we can find a medication that does help the child's symptoms of ADHD.
He says if you see a child struggling in school, get them evaluated. Whether they have a disorder or not, their self-esteem is on the line.
I just had a patient with 117 IQ that was making C's, D's, and F's. You shouldn't do that. And yet the parent says, the teachers say there's no problem. Well, there's a problem if you've got 117 IQ and you're making C's and D's and F's.
Dr. Kent says there are 2 primary treatments for ADHD, making environmental changes in the classroom and at home, providing organization techniques with family and teacher intervention, and medication for those with more hyperactive or inattentive sub-disorders. Alyssa Cole, Fox 23 News.
According to the Yale Clinic for Attention and Related Disorders, medication is just one aspect to treat someone when diagnosed with ADHD. Skill building using technology and other strategies are also important techniques to use in treatment.